this is our very first webinar that has been organized by Versa Research, and this is to commemorate the World Environmental Health Day for 26 September 2020. We'll be talking about the impact of the environment on our health and what we can do. And we have two guest speakers here that I'll be introducing to talk to us shortly. And please follow us closely on this discussion, and let's get our questions ready for the Q&A that will come up after the speakers have spoken to us. So today we'll be talking about the impact of the environment on our health and what we can do about it. Okay. So environmental pollution is one of the most serious global challenges that we have, and this is as a result of accumulation of waste disposal that are not being disposed of properly, electricity, burning of fossil fuels, and all of that we emit into the environment. So the total emission of this is called carbon footprint, and these emissions are called greenhouse gases. So the contamination of the physical and biological components of the Earth's atmosphere system to such an extent that normal environmental processes are adversely affected is what we term environment pollution. And according to World Bank, globally, as of 2016, about 2 billion tons of waste was being generated, and about 44% was food and grain, 12% plastics, and 17% cardboard and paper. This shows that these wastes are not being disposed of properly, and as a result, a lot of toxins are being released into the environment, which in turn causes harm to our health. And WHO, the World Health Organization, are attributable to preventable environmental causes. So we put together this webinar to help us understand what we do as an and as an organization in the environment, and how we can make the environment better, and how we can also improve our health. So our first speaker for today is Dr. John Oladele. Is a medical doctor and a health economist as well. And he'll be talking to us on different things, on both natural and man-made things that affect. Dr. John, you're welcome. And take. Dr. John, I think you're muted.
Okay, good afternoon, everyone. So I'm sharing my screen now. I hope the screen can be seen. Please confirm if my screen, if you can see my screen very well.
Yes.
Okay, so thank you. So I'll be presenting on different things, natural and man-made, on environment that affect our health. And it's been, you know, talking about the environment can be, the word is a French word actually, which can be broken down into environ, which means around. Okay, and the environment is actually the fundamental system that supports all life forms on Earth. Without the environment, there's no life can even exist in the very first place. And the environment that we're talking about is actually made up of two types, mainly the natural environment and man-made environment. So if we're going to understand very well the impact of the environment on our health, we need to also understand the interface that exists between human health and the environment. And most of the time, this has to do with the way our environment is designed, the way we implement some changes, and how we also monitor some interventions. It has also been shown that demographic patterns and urbanization, including economic forces, ethics, and indigenous knowledge and culture, can also have an effect on how the health affects our environment. Depending on what we do, it can have a positive impact or a negative impact. And also, nutritional status also plays a very key role in maintaining a healthy body. WHO actually estimated that 30 million deaths annually are attributed to preventable environmental causes. And 24% of the global disease burden and 23% of all deaths are actually attributable to environmental factors, with the environmental burden of diseases being 15 times higher in developing countries than developed countries. And the reason why we have this much difference in developing countries compared to developed countries has to do with the fact the level of exposure to environmental risk that we experience in developing countries. People that live in developing countries have been shown to be exposed to higher level of environmental risk compared to people that live in developed countries. In 2000, climate change was estimated to be responsible for approximately 2.4% of worldwide diarrhea and 6% of malaria. And the study in Mexico also revealed that lower greenhouse gases emissions will result in a avoidance of some 64,000 premature deaths over a 20-year period. So in this slide, I'm showing the 10 leading causes of death by broad income group. This was done as far back as 2004. Let me enlarge it a bit. Let's see if I can enlarge it. Okay. So in this slide, it was divided into low-income countries and high-income countries. And looking at the low-income countries, we could see that lower respiratory tract infection is accountable for the highest percentage of death, which is followed by coronary heart disease. Looking down to the high-income countries, realize that coronary heart disease is accountable for 16% of total number of deaths, followed by stroke and other cerebrovascular diseases. In lower income countries, HIV/AIDS, diarrhea disease still account for a sizable number of deaths that's being recorded. Whereas in high income countries, we realize that most of the challenges that they have to do with chronic illnesses and chronic diseases. Whereas in low income countries, still battling with infectious diseases. That's why the lower respiratory tract infections account for the highest number of deaths. Okay, so looking at Africa as a whole, what does the emergency situation in Africa looks like? Okay, so the emergency situation in Africa is very complex, so it could be natural. And we also have about 56 and 33% of global complex emergencies and epidemics between 1995 and 2004 occurred in Africa alone. And Africa is second only to Asia in terms of occurrence of natural disasters. So we can see that the impact of the environment on our health and on our livelihood, it's actually very, very significant. And all the regions of Africa, Southern Africa was mentioned to be particularly prone to natural disasters. They are prone to floods, cyclones, droughts, and epidemic outbreaks. And in general, emergencies negatively impact on the health and nutrition of affected population. So I'm also trying to show to us some key facts about health emergencies here. Number one is that the occurrence of public health impact of crisis depend on other sectors such as protection, shelter, and water, sanitation, and hygiene. Some emergencies have direct impact on health, while some are indirect. So the examples of the direct impact on health are the earthquakes, conflicts, mines, trauma, lacerations, fractures, and amputations. While the indirect impact on health are the floods, droughts, cyclones, due to endemic diseases, malnutrition, mental health, and psychosocial problems, and maternal child health, MCH. So, for example, in some countries are very prone to flooding. For example, Namibia, Mozambique, Malawi, Zambia has been recorded. I know even in Nigeria, we also have some states that experiences some occasional flash floods. For example, the island part of Lagos that includes Ikoyi, Victoria Island, and Lekki, even Kogi State, Bayelsa, and the other riverine communities, and the communities that are along the River Niger and River Benue experiences flooding occasionally, not even occasionally, it's even like annually now. Drought It's been shown that in Madagascar, Zimbabwe, and Namibia, they've been recording a sizable occurrence of drought. Then some emergencies have direct impact on health. Like I said, the repetition of the health. So what are the impact of disasters on health systems? Because when we say that some of our environmental impacts affect our health, even if it affects our health alone and it does not affect the health system, I think it's going to make a lot of sense. But the truth of the matter is that it does not affect just only the health of individuals. It also affects the health system that's been put in place to take care of individuals when they fall sick. And number one is that on health workforce, we realize that even the health workforce too will be susceptible to illnesses, disabilities, and death due to hospital-acquired infections, injuries, and violence. For example, during this COVID-19 pandemic, we realized that a sizable number of healthcare workers also contracted the coronavirus disease when they were through rendering care to COVID-19 patients. Displacement as a result of insecurity or destruction of living quarters. For example, when flooding occurs and the hospital or the healthcare, the designated healthcare service provider is flooded, there is no way to be able to carry out their own services too. So that means that the facility will need to be displaced or moved to another place, and which will pose a problem for people that are affected in the area. It means they will have to travel far to access healthcare. Psychological trauma due to illness, death, and disability of colleagues and displacement. This is a very big, significant effect on healthcare workers, in the sense that it's very traumatic seeing someone that you work together, rendering services to sick people, being susceptible to such illness and dying from it. It's kinds of have a very serious psychological toll on colleagues because they feel like, oh, okay, so this could be me. Then health information management usually collapses when we have a significant level of disaster. Inability to effectively monitor health performance and status, medical product, vaccines, and technology becomes a problem. In some areas where it's accompanied by insecurities, we can also experience looting of medical supplies and equipment and breakdown of supply chain management system. Health financing too, it means that financing our healthcare will become a challenge because now the meager health resources available will need to be diverted to other sectors so as to cater for the other aspect of emergencies. Then there's also going to be increased cost of delivering healthcare because number one, it means you need to employ more people, you need to get more facilities that you need to deliver healthcare services to the people. It's also going to have effect on leadership and governance. It could lead to breakdown of strategic policy framework for health. There could be lack of oversight function because at that particular point in time, everybody just gets it. For example, this COVID-19 pandemic, because there is no clear and appropriate guideline on what's needed to be done in the initial stage, we realized that most healthcare providers they just kept on trying things. They hear maybe a particular another facility did something that tends to work, everybody tends to follow suit. So since there's no clear guideline in this kind of situation, we can have challenge supervision and monitoring and evaluation in situations like that. The inability to enforce health regulations and ensure accountability will also affect the health service delivery. So everything that I've been explaining so far will lead to reduced access to health services, poor coverage of public health interventions, and poor quality of available health services and unsafe healthcare services. So what are the effects of man-made disaster on the environment? So we're going to have three things. Number one is going to affect our air quality, it affects our water quality, and then climate change. So let me get to noise pollution first. Noise may be defined as unwanted sounds that create a negative effect on human being. For those that live in Lagos, I don't think I need to even say so much about noise pollution, or because of the small size of Lagos State and the number of population that it handles. I think most people in Lagos are kind of exposed to a very high level of noise pollution in their day-to-day activities. And noise pollution is accompanied by psychological and physiological effects, okay, that can have on human beings. This could mean high level of stress, it could mean high level of arousal, it could mean narrowing of attention, reduction in reading comprehension, and performance decrement in general. So moving on to air pollution. It's a major environmental risk to health and is estimated to cause approximately 2 million premature deaths worldwide per year. It is a major environmental risk to health and is estimated to cause the 2 million, like I said earlier. So if we reduce air pollution, we're expected to reduce the global burden of diseases from respiratory infection, heart disease, and lung cancer I showed earlier, especially in low-income countries, which show that the highest number of deaths is due to lower respiratory tract infection. So which means that if we're able to address the issue of air pollution effectively, it means that we're going to significantly reduce the level of mortality that we witness in this part of the world. So air pollution also has its various components, leads to physiological problems such as reduced visibility, eye irritation, headache, nausea, insomnia, and various respiratory and related diseases. Okay, it also goes with psychological problems too. Okay, so because, for example, we realize that there are more emergency visits to the specialists for depression when which are viewed by individuals as cloudy and humid. Okay, and at the same time too, there are particulates and poisonous substances that are also involved in our response to impure air. And bad smell also evoke negative feelings, and an environment which has pleasant smell, tends to provoke, or improve positive and friendly behaviors compared to environments that has, unpleasant smell. So talking about water pollution, as at 2 days ago, we recorded about 2,596,108 deaths from dirty water and related disease globally. And, water is an essential part of life. And looking at this, how important water can be, realize that in some industries, for example, in chocolate industry, they spend about 24,000 liters of water to produce just 1 kilo of chocolate. While we also have 21,000 to produce 1 kilo of coffee beans, 12,100 to produce a smartphone, and etc. According to the European Commission's recent statistics, 20% of all surface water in the EU is seriously threatened by pollution. I don't currently have the figure for Africa. Contact with unsafe drink or bathing water can impose serious risks, both acute and delayed, and lead to human health. So microbe contamination of groundwater due to sewage outfalls and high concentration of nutrients in marine and coastal waters due to agricultural runoff are among the most serious threats. So what are the sources of this pollution, of water pollution? Discharge of untreated raw sewage from households and factories, chemicals that are dumped from factories too, agricultural runoffs that make their way into rivers and streams and groundwater sources, urbanization, the rise of synthetic organic substances, oil spills, acid rain caused by the burning of fossil fuels, human littering in rivers, oceans, lakes, and other bodies of water, harmful litter that includes plastics, aluminium, glass, and styrofoam. So the effect of polluted water on humans could mean that, one, pesticides can damage the nervous system and cause cancer because of the carbonates and organophosphates that they contain, and the chlorides can cause reproductive and endocrine damage. Nitrates are dangerous to babies that drink formula milk because it restricts the amount of oxygen in the brain and can cause what is known as blue baby syndrome. Lead can accumulate in the body and damage the central nervous system. It can also lead to cause anemia in people that have lead poisoning. Arsenic can cause liver damage, skin cancer, and vascular disease. Fluorides in excessive amounts can make the teeth yellow and cause damage to the spinal cord. And petrochemicals, even with very low exposure, can cause cancer. So what can we do? This is what we can do. Let's avoid throwing litter in the ocean. Let's dispose chemicals, paints properly and not dispose them in water supplies and drains. And if you see, we can also report, for example, if you live in an environment whereby people dump litter in the drainages and all of that, we can actually report them, especially in Lagos, we can be reported to LOMA and other agencies. And can also help increase increase awareness by educating our children and increasing awareness within our community. So this is a diagram that shows the impact of climate change on our health. So from severe weather, we can have injuries, fatalities, mental health impact. The air pollution can lead to asthma and cardiovascular disease. Water quality impacts can lead to cholera, Campylobacter, leptospirosis, and harmful algae blooms. And water and food supply impacts can cause malnutrition, diarrhea disease. Extreme heat can cause heat-related illness and death, cardiovascular failure too. So climate change affects the social and environmental determinants. Affects everything that happens to us. Affects the air, the water we drink, the food we eat, even the places we live in. It's been estimated that between 2030 and 2050, climate change is going to cause an approximately 250,000 additional deaths per year. That will be due to mainly malnutrition, malaria, diarrhea, and heat stress. And the direct damage of climate change, direct damage cost of climate change to health, has been estimated to be between 2 to 4 billion US dollars per year by 2030. And areas with weak health infrastructure, especially in developing countries, of course, we know that we have the biggest challenge to cope with this disaster when it happens. Over the last 50 years, human activities generally have been the main issue that's been leading to increase the number of carbon dioxide and other greenhouse gases that affect the global climate. And in the last 130 years, we have been noticing that the world temperature had been increasing approximately by 0.85 degrees Celsius. And sea levels have been rising. Glaciers are melting, precipitation patterns are changing, extreme weather events are becoming more intense and frequent. This shows that there's a terrible days ahead. Climate and weather extremes are manifested also. And this is leading to food insecurity, social disruption, and population displacement. And talking about this population displacement, I can bring this home to expatiate more on the farmer and the pastoralist clashes that we've been witnessing in a part of north central of this country. Climate change has shown some significant ability to cause conflict. For example, the size of the Lake Chad basin has been shrinking year in, year out. And this has shown to be responsible for the downward migration of pastoralists from the extreme north to the north central and downward south. This has come with its own insecurity. This will also favor spread of communicable diseases because it means that people move from one point to another, which means that diseases that are prevalent in one area will soon start showing in other parts of the world. So climate change may be responsible for hazards such as diverse as heat waves and cold spells, smog and wildfires and other events. Global warming, which is resulted from climate change, will increase the prevalent endemic diseases, both partially and in magnitude. So what are the things that have been slowly evolving conditions? We have from environmental sanitation, we have challenges with food security and safety, because for example, the villages where they plant food, where we have farmers that cultivate foods and all of that are having challenges staying in their villages due to insecurity. We are having sea level rise now, so which threatens the communities that live along the coastal regions. Human migration and urbanization, people are leaving their villages now to the cities. They also have other health implications. Thank you very much, everyone. Wish you all the best. These are my references for those that will need to read more and study more about this. Thank you very much, everyone.
Thank you, Dr. John. Thank you very much. Please, if you have questions, you can drop them in the chat section. This is to all of the participants we have on board. You can drop your questions in the chat box and we will make sure to answer all of it as much as we can. Okay, so our second speaker for today is Victor Boyle-Komolafe, and he is a circular economist and the co-founder of GIVO. And he's going to be talking to us about how we as individuals can make our environment better. Welcome, Victor. Thank you for joining us.
Thank you, Kemi, for the introduction, and thanks to Versa Research for having me. Yes, as Kemi mentioned, my name is Victor, and I'm the co-founder of GIVO, or GIVO, or however you want to call it. And I'm going to be speaking, yes, on the topics you mentioned, but more in particular about how to reduce our carbon footprint. So while I'm loading my slides, I'll just speak a little bit more about what I do, which would inform why I guess I was chosen to speak about this. GIVO, it's the full meaning is garbage in, value out, and it's a recycle tech circular economy company. So this is what we do in our daily lives. And sorry, let me just do that. Okay. Yeah, so this is what we do every day. And, you know, so we're always looking for new ways to reduce our carbon footprint and recycle more, really. Okay, so I'll go straight into it. How can we reduce our carbon footprint? Again, in the Nigerian context, I guess the word, or in the African context, the idea of what carbon footprint is still a bit new. And really, it's just really that, you know, we know that everything we do has there's a reaction, there's a consequence to it, right? And really, the same thing the same thing applies in essence relating to the environment. So everything we do or we don't do has a direct reflection on the environment. And, you know, as Dr. mentioned earlier, he mentioned a lot of the consequences. And I guess what I'm going to be speaking about more is focusing on how we can prevent some of these things. Again, when we're speaking about footprints, or carbon footprint, the three major areas we focus on is the home energy. So again, what do you do in your house, and how does that affect the environment? You know, so your buying choices, your eating choices, and then transportation. How do you move? How do you, again, transit? We have to move around, but we can be more, we can make better choices, because again, every choice we make has an impact on the environment. And of course, waste. How do you and what do you do to your waste? I'll just go straight into here. So I'm going to speak about 10 things that were, again, ways to reduce our carbon footprint. And I would start from the first one. Again, this is not in order of importance. You know, I'll start with the first. So switch to renewable energy. I think that's pretty easy. So renewable energy refers to energy that is renewable, right? So instead of fossil fuels, which aren't renewable, you're using hydropower, or, you know, in a popular one is solar or inverters. So that is a low-hanging fruit that we could definitely do, right? Rather than using diesel or fuel, you know, to power, say, the generators, right? So, for example, if you need an excuse to buy a Tesla, this is one. The second thing is, of course, minimize driving. So this is key. Again, minimizing the driving that we do, and trying to share as much as possible, or walk or cycle, is the best way to go. So that's why in some climes, you can see there's a lot more investment in public transit, because again, the world realizes that we need to build less highways and more railways, right? And so these are ways to reduce carbon emissions. Again, I won't do too much about this, but, you know, practical ways we can fix this is, again, carpooling. So instead of having, you know, I know families that in the morning, you know, dad goes to work, mom goes to work, the kids go in separate cars. You know, that isn't really efficient, isn't good for the environment. So we need to carpool as much as possible. The third one I will speak about is, again, really minimizing the purchase of resource-heavy products and packaging. So, you know, I think the doctor mentioned, for example, about the amount of water that goes in cocoa, you know, and some of these other products. When you know the facts, you would realize, or you start to wonder how important cocoa is to you. So again, these things are actual practical things. You can decide not to do it, but if you actually want to make a difference, you have to consider these choices. Is the chocolate that you love that important, or is the environment more important? Again, embrace the minimalist lifestyle. Again, let us stop buying things and collecting things, hoarding things. Again, buy what you need. Give out what you don't need. Don't throw it in the refuse, for example, right? There's charities, there's people you can bless it with. And that way, the goods, it can keep on flowing within the circular economy. And the other thing that's also important is buying used, right? So used cars, used electronic. There's sometimes there can be there can be a perception about it, but the honest truth is, again, apart from it being more cost effective, you're actually doing good for the environment. So you have something there. 5 and 6 is really, again, reducing energy consumption. I spoke about that a little in the first, but this is really regarding the appliances that you purchase, right? So one easy way to do it is, almost everywhere in the world, there are low voltage bulbs, right? Or energy efficient bulbs. Now, increasingly, these are becoming more and more affordable, so about $2 each, and they can last for a year or two. So these are ways to again reduce your energy consumption, and of course reduce your carbon footprint, and the same with your televisions and other things. And the sixth point is to buy local, right? To buy, I use the word organic a bit richly, but really buying local. And for buying local, something that we don't realize is the amount of, again, in terms of carbon footprint. So when you buy imported goods, for example, and you think about the carbon footprint of that imported good, you think that it came from, say, a farm in France, and then went from a farm in France to a warehouse in Dubai. And from a warehouse in Dubai, it went to South Africa. And then from South Africa, ShopRite aggregated it to Nigeria, right? Like, you buying that product, right? You're contributing directly, whether you believe it or not, to that journey, right? And so these are reasons why you need to buy local. And apart from it stimulates the local economy and all of those things, you're actually impacting the environment directly. So buy local all the time. And of course, the more local, and of course, because there isn't need to preserve it as much, it's probably more healthy and more organic. I don't like using the word organic, because that has its own standards, but in the African context, let's say it is organic in terms of it doesn't have a lot of those GMOs that is associated with some of the other countries. And so number 7 is save water. Trump was speaking about this the other day. The water faucets in the States now have been changed a few years ago, and so they don't come out the same way, and he's trying to change that. But these are, again, practical ways. I know people that have 10, 20-minute showers, and I wonder, like, how many people you're showering for at a time, because it doesn't make sense. You don't need a 10-minute shower. Like, come on. So you need to, like, slow down on that, right? Maybe sweat less, or I don't know, you change your clothes. So yes, I would also say, watering gardens and watering plants. We tend to do that too here. We do water the garden every morning, all of those. It's cultural, it's not ideal. We need to reduce those. If you see, for example, you read about Cape Town and what's happening over there, then you realize water is a commodity and it should be treated as such. And it will not be there forever. So we need to do more. And number 8 is really, embracing the circular economy. The circular economy preaches more of reduce, right? So reduce packaging, reduce the use of materials, reuse. So again, where you can reuse. So again, reuse plastic bags or reuse bottles, and recycle. So, after you reuse, or if you can't reuse, you can recycle. About almost everything can be recycled. So this applies to, to literally almost everything. And then versus the linear economy, which is what we do right now, which is, again, take, make, and then dispose, right? So that's why we have landfills and we have garbage all over the streets, because, there's nothing really planned afterward for that. So yes, try to reuse as much as possible. Take your own back to the grocery store. Stop, taking the bags from the clerk as they're giving it to you because you know better, and so on and so forth. The last two, minimize food waste. So it goes without saying, most of the food, something Kemi mentioned earlier on, majority of the waste is food, right? About 40% is food waste. And if we reduce the waste if we reduce our portions, or we were more cautious about that, or our preparation, then the waste will reduce, and that would reduce the 40% that it is currently, right? It all takes everybody doing it in their places. And of course, composting waste. So again, like I said, there is always another use for waste, right? For anything. So in terms of waste, compost is a very good source of manure for plants. So and it's actually quite valuable, to an extent. And number 10 is support and encourage circular economy practices and organizations. Yeah, I like this one. Thank you, Bisola, for putting this on the slide. Bisola works for me. So yes, you need to support people like us doing good things with the environment, because we're just one organization. We're just a group of people that are committed to change. But again, if there's people like us all over the place in different communities, then we can effect change a lot faster, right? And some of the ways you can support is, again, like what's what I'm looking for, volunteering, again, participating, so recycling, becoming an advocate in your own area, I mean, with or without GIVO. So yes, there's practical ways that everyone in their own places can make a change, right? And I think I would end by saying, again, change begins with everyone. Change begins with each of us, and we know the problems, right? I'm sure we didn't need, we don't need a webinar to tell us that. I'm sure after hearing all doctors said, we agree with most of that. We know all those things, right? But what are we going to do about it? I think that is key. So thank you very much for your time. I'll hand it back to Kemi.
Thank you, Victor, for your presentation. I'm sure we all have questions we want to ask. Again, please drop your questions in the chat box, and we'll try to take as much as we can. And the ones we can take, we'll make sure to answer them and put it on our social media pages that will display right after the conversation. So Dr. John, we have a question for you here. So the first question is, this is from Dara. Thank you for the presentation, Dr. John. Are air filters medically recommended for combating air pollution? So air filters and pollution. Over to you.
Thank you. Air filters, I think air filters have been shown to be effective in some environments. For example, I know some medical facilities have air filters in the environment, especially in the theaters, in their intensive care units, to make sure that the air that goes in there has no pathogen. So it's good, but the challenge we have with air filters is that it's expensive to be installed in all public buildings, and it's not very sustainable on the long run, because it means that you need to maintain it. For example, if you put it in a public building, you need to maintain these air filters, you need to service it appropriately, and if you put it in a business environment, it means that it's also going to increase the cost of doing business too. So, but what can we do in this kind of situation is to actually reduce the amount of emissions. I think that is a sustainable thing that we can do to reduce the amount of emissions that goes out there. And every one of us can contribute to that effectively, from the gas stove that we use in our house, from the kind of car we drive in our homes, from the electricity consumption that occurs in our homes too. So, like Victor explained earlier, the bringing down the reducing the carbon emissions, it's a duty call to every one of us to make sure that our environment is sustainable. So I think how we go more with something that will be sustainable in the long run, rather than a quick fix solution to some of these problems. Thank you.
Okay, thank you, Dr. John. Another question for you. So you said in one of the slides that the environment causes psychological health problems. Example of more emergency visit for depression when the environment is cloudy or humid. So what can we do in our environment to better our psychological health? Dr. John, you're muted.
Oh, okay, sorry. It has been shown that the number of cases of depression that's been seen in healthcare facilities tends to be on the increase during winter season or very cold season. So that's the explanation for what I said over there. So what can we now do to better our psychological health? It means that in this, when we have that kind of environment, we need to learn to keep ourselves warm, we need to maintain positive attitudes, and possibly we need to find good friends that we can trust, that we can relate with, be in company of good people, especially for those who are susceptible to depression, to hang around people at that particular period of time. And if you notice that you're having depressive symptoms, if you are having suicidal thoughts, please go to the hospital. It's not it's something to be ashamed of. It's just like you have a normal other sickness that you are placed on medications for. So please, if you show any symptoms of depression, visit the clinic, you'll be placed on medications, and I bet you're going to be fine. Thank you.
Okay, thank you, Dr. John. Okay, so can you give examples of lower respiratory infections and what exactly in the environment causes this?
Okay, fantastic. So the most popular, the most common lower respiratory tract infection that we know is pneumonia. And most of the time, these are caused by pathogens. Respiratory tract infection can be caused by bacteria, by viruses, by fungi, and by other parasites too. So it all depends. But the best way we can and what in the environment causes it? Okay, so for example, let me just use COVID-19 as a perfect example for this. When someone who is infected with COVID-19 sneezes or coughs out, and someone that is around that person within 1 meter distance, it means that the hair around that person is already contaminated with the virus. So someone inhaling that kind of hair can become susceptible to coronavirus disease. So, which means that contaminated hair can be a cause to some of these respiratory tract infections. And the best to avoid it is to maintain respiratory hygiene all the time.
Okay, thank you, Dr. John. Victor, this question is directed to you. So how effective is solar energy in powering our devices? Victor, you're muted.
Yeah, sorry about that. So yeah, I think that's a good question. But I guess when you mean devices, you're speaking about mobile phones or TVs or even vehicles, right? So solar energy can 100% power almost anything that you can think about, right? So yeah, solar energy is a very good and an efficient source of energy, and it can power everything. So I hope
Okay.
that.
All right, thank you. So you mentioned recycling using old things, it keeps going. So, but then as individuals, because we know how sometimes it can be difficult to get used things that you have used out there. So how can you recycle maybe your plastics, packages you get from buying food outside and all of that? How do you think we should do that?
I think that's a very good question. So, a few things off the top of my head is number one, recycling. The first and the most important bit of recycling, right, is sorting the waste, right? Like that can't be overemphasized, right? Because once two streams of waste come into contact with each other, there's contamination and it loses value, right? And so the first step really is sorting waste. So organic waste, which is food or food-related items, needs to be kept away from, say, and plastic waste, right? Or say cardboards, right? And so, for example, plastic waste, which will have, very most likely to have liquid inside, should be kept away from cardboards. So when you start having everything mixed up, like it's a cocktail for disaster, right? And so, in fact, this is why most of our waste isn't recyclable. So, I mean, if it was even sorted, it could be recycled, but it is not recyclable, because from source, like we're not even trying. So I would say one easy way to start doing it is sorting your waste. And once you sort your waste, then it's easier for you to, again, go to your closest recycler, right? And there's a few around. I'm sure you can find it in a Google search, or you could follow GIVO at GIVO Solutions. And we could probably look into that for you. But again, if you're able to bring in your items or give your items to those recyclers, then they would recycle it appropriately. But again, there's no point going to recycler with a bag full of different garbage. Like, you're not really helping anybody. You're not helping the recycler also, right? So start with the sorted. If you have it sorted, then I'm sure almost any recycler would love to take it off your hands. And so, yes, that is, I would say, how to recycle. And it's not just, bottles or trash, right? It's also like the clothes you wear, right? You can give it out, right? So don't put it in the trash. If it's still good enough, give it out, right? Or do something fashionable, right? Some people like to do, use it. There's other uses for it. It doesn't have to be thrown away.
Okay, thank you, Victor. So I have another question for you. So talking about recycling and sorting waste, I want to bring it down locally now to Nigeria. So most of us, especially on the mainland, I don't know about the island, it's either Loma is coming to pick up your waste in the house, or maybe all these guys that push trucks, you just dump it to them. So how do you think we can actually go about it? Because me telling the outside guy, I mean, I can't even really explain to him like, this is what I want you to do. So me telling him that, oh, this is plastic, this is food, and this is clothes, how do we create a balance with that? Even for Loma, I mean, these guys are not patient. They just want you to throw in your trash into their truck and drive off. So how do you think we can, make a balance with that? Do we get, organizations like yours to maybe come pick it up, or maybe there's like a meeting point where we can drop it, or, how do we go about that?
Thanks for the question. I think one of the biggest issues with, yes, apart from Loma and all that, one of the biggest issues with plastic is that it's voluminous, right? So it has a lot of volume, right? So you have a big black bag, black bin bag, right, of plastic, right? And that might not be up to 3 kilograms, right? Again, I don't know the exact figure, I'm just saying. So first of all, and that value is not so much, but it takes a lot of space, right? And so this is why there's probably not a lot of recycling companies that will be willing to come and pick it off you, right? Because again, the value of that is not great. I mean, they're not CSRs, right? They're businesses, so they have to put that into consideration. However, if you had a room, for example, so I do this in my house, I have a room where I'm just stacking it, storing it, right? And when it gets to a particular point, then it becomes economically viable, right, for a recycler to come and pick it off me, right? So that is one instance. Otherwise, you could always go drop it off at your recycler. So, just plan your routes, right? So on your way to work, you just drop off the items, every 2 weeks. So that can be done. But regarding the, again, I understand that, waste management economy is really what's what I'm looking for, is informal, but it's largely informal, right? But I will put it to you, the llama guys and the truck pushers, they know the value of these products, right? Because again, I don't know if you see the llama on the llama trucks, they'll be throwing the garbage, right? But you see sometimes hanging onto the trucks is sacks of plastic inside, plastic bottles. So yes, I mean, if you gave it to them separately, I assure you, they will not throw it with the trash. They would keep it separately. So again, also for your truck pusher, that's actually what they do. So give it to them separately, and by that, you've even given them more value. Again, they would appreciate you for that. Try it, because again, giving them, again, without it being contaminated, ensures that they can get the maximum value for that. And so again, in the case of a truck pusher, right, who earns, I mean, $3 a day, give or take, or $2, that product you have given him, is probably half his day's wage. So yes, it's, from that point of view, you're actually doing more for the economy.
Okay, so you're saying to us now that these guys actually know what they're doing, and we should try to make their job easier.
Do you think the truck pusher is coming to your house because he wants to collect your garbage to like play with it?
Yeah.
Like, he knows what is inside the garbage. So yes, they're getting the value from it. So you're helping them maximize their returns by sorting.
Okay, thank you. All right, so we have one last question for you. Chanil says that how much does global warming sit with individuals versus companies, and what can we do as individuals to push the government to implement legislation that compels industries and individuals to act sustainably?
Yeah, so this is a very interesting question. Thanks for this. Okay, so I think, how much does global warming sit with individuals and companies? I think everyone has a responsibility, to be honest, right? So Coca-Cola produces and you buy it. So if you don't buy it, then I mean, you're not responsible. But then if you buy it, you are responsible, right? So Coca-Cola has their own responsibilities. Sorry, Coca-Cola, if you're listening. But I think it really, at the end of the day, the buck stops with us, the customers. Because when we choose not to buy, then things change. I mean, you look all over, everywhere, right? I mean, look at the Black Lives Matter movement. Sorry, I'm going so far, right? But again, when customers identify with something, right, then brands are forced to change, right? And it's not the other way around. So, as long as people keep buying the Coca-Colas of this world, then they're not going to change. It goes without saying. And again, in terms of what power people can do, I think really our role in this is really about educating people, right? Because again, I mean, also, I guess I'm a bit of a pessimist. So, in terms of government change and legislation, again, those are things that will be great, right? But then I think it's a bit too far. However, there's a lot of things like extended producer responsibilities, right, that exist in a lot of countries, but are not being enforced, right? So again, it starts with educating people, right? When people understand more and understand the rights and understand again that there are some of these mechanisms in place, right, that should be enforced, then maybe that would swing the government and the private institutions around. But right now, not a lot of people care enough. And I think that is the first part: education, advocacy, participation.
All right, thank you. Okay, I think that was the last of the question. Thank you very much, Victor. Thank you, Dr. John. Thank you guys for joining. Abisola, Adetola, Dara, Damilola, Faith, Yetunde.